Then hey guys, hello. So let's solve the 20 clinical cases for the FMGE exam, guys. So here is the first question. Just follow me how I am solving and what are the important points I am filtering out. Okay, so here this is the first case. Yeah, see, this is the first case. Just observe me how I am solving the MCQs. That's okay. A 30-year-old AIDS positive truck driver. OMG. AIDS positive. AIDS positive. Okay. Tell me here, if it is a AIDS positive, okay, then what is the drug? First tell me. Out of all these, azithromycin? No. Fluconazole? No. TB? No. It's going to be cotrimazole. This is the only drug now we are using for the AIDS patient. See, it's very easy question. So you can mark the answer like this one. If you want in detail, we can discuss. Remember, truck driver. In dermatology, if they give truck driver as a history, then you can mark the what? Syphilis, isn't it? So here, see here. Okay, listen this one. 30-year-old AIDS positive truck driver. So AIDS positive. Okay, now suffering from fever, breathlessness for the last 5 years. Auscultation, there is a crepes in the bilateral. You can see the bilateral. You have in the patchy. You have in the infiltrates, meaning what? Severe infection. Okay. SPOT drop 80%. OMG. And there is a bronchoalveolar lavage is done. This is the report of this one. Okay, so whenever you are thinking about the AIDS patient, so this is going to be what, amma? Pneumocystis gyrosis, isn't it? Okay, what is the drug of choice for that one? It's your cotrimoxazole. Okay, cotrimoxazole. Yeah, done. See, it's very easy. Very easy. See the answer here. They given this one only. Okay. The next one. See here. The subject how I am solving. Next question. Yeah. A 35-year-old woman present with a weakness in both legs for the past 2 days. OMG. Weakness in both legs. Meaning what, amma? Meaning weakness in both legs means what? Is going towards upper or lower motor neuron lesion. Obviously lower motor na. See, okay na. So suppose this is the Poisson cone. Okay now this is the word. So nerves which connecting to the muscles, it's going towards your lower motor neurons. Okay now, so it's a lower motor neuron lesions. On examination, bilateral knee jerk. Oh my god. On examination, bilateral knee jerk and ankle jerk is absent. Oh my, there is a reflexia. Okay. However, see here, schiromedia. OMG, schiromedia. Okay, G for GB. Okay, Gallagher-Bellin syndrome. Campylobacter jejuni. That's it. Khatam. Whenever you see the schiromedia, okay, done. This is the Campylobacter jejuni. Done. Khatam. This is the answer. Okay. Very good. Next one. See how you are going. The main thing is that what is the important points you have to remember. That's it. Okay, next question. Okay, next question. Here third question. Let's see. An 80-year-old man here. Okay, 80-year-old man is having severe low back leading to the difficulty in daily activity. He takes painkiller daily but no relief, he noted. Recently he has also started developing swelling around eyes in the morning. Okay, resolved. So he is having what, amma? First tell me. low backache. Okay, low, he's having backache. Okay, now he's having backache. Yes, just mark that here. Backache. Difficulty in activity. He takes painkiller but no relief. Recently he had started developing swelling around the eyes. Morning, which results in there is a it is a puffiness. Okay, now it may due to the low albumin levels. Okay, see here, morning MRIs. Oh my goodness, see here, it's a lytic lesions. Oh my, MRI shows lytic lesions. Okay, hemoglobin A, there is anemia. Oh, anemia. Okay, ESR is high and creatinine is also high, 3. Oh my goodness, creatinine is 3 also, and blood urine nitrogen is 80 mg. So what's the diagnosis? See, if you see the MRI shows lytic lesions, so, and also there is anemia, this is going to be your crab criteria. Your crab criteria. Okay, now crab criteria, there is a anemia, there is a bony lytic lesions here. Okay, now there is a renal failure also because the serum creatinine is 3. So by seeing the lytic lesions you can mark the. So what is the diagnosis here? You have to which is the next step for the management of the patient is going to be your what? Check the urine for the paraproteins. Okay, no hemolysis, check urine. Okay, schedule for kidney biopsy, no. Start potential, no, because there is a lytic lesions. If there is a hence they already tested as that. See here, morning puffiness, there is morning swelling. So we may be like mark the answer as the like it's going toward the nephrotic syndrome, so we can start the prednisone, but no. So you have to do the check for the urine paraproteins. That's it. Yeah, next question. Okay, next question here, where is that? Yeah, 3, 4th one. Yeah, done here. See here, very easy questions here. See here, Sadi. 65-year-old man experiences difficulty in changing channels in a television remote and buttoning of his shirt. He takes longer than usual morning for walk. Uh, and he having what amma? See here, rigidity and bradykinesia. It means it's going towards your Parkinson disease. Okay, now see the answer. Which of the following is not used? Not used means it is here tetrabenazone. Tetrabenazone for what amma? Tetrabenazone for the your Huntington's chorea, isn't it? Huntington's chorea. So just see the option. First of all, you have to see the option. So according to me, see when I am solving this question, so I just cross checked. Okay, na at entacapone we have to give, cabergoline we have to give, but I don't know about what is apomorphine. But I know that okay, tetrabenazine is for the Huntington's chorea, so I rule out this answer. Okay, done. So it is tetrabenazine. So that's how you have to. So that's how you have to rule out the questions. Okay. Yeah. See here, na? See here. Okay, done. A 25-year-old burn victim is admitted hospital for the last 1 week for the. Okay, see here, he is the burn patient. Okay, now as you know that in burn, what are the chances of, what are the most common complications? There is a septic shock. As you know that here, he's having, see here, the BP is how much amma? BP is 160. He was on dobutamine. OMG, why? If there is a septic shock, I think when we were in abroad or in India, when you are doing the internship or you are going to you are like doing doctor's duty, so the patient who has like septic shock, they will keep on like a dobutamine, or okay, they will keep on the dobutamine, okay na, or NORAD, because there is a septic shock. That's why there is a BP will be fall, isn't it? So by seeing the BP only, he was on dobutamine, so we can have we have to check that. You have to clarify one thing is that okay, this may be going toward the MODS, like multi organ dysfunction, maybe due to septic shock. So it's a burn condition, so it may be it is due to Pseudomonas aeruginosa. Okay, now whenever you see the bone patient, it must be Pseudomonas aeruginosa is in your mind. Okay, so it is a gram negative motile with a rod with a single polar flagellum. Okay, done. See here, next one. Done. Test. Okay, see this one. This one, see here. 50-year-old man has been diagnosed with the liver cancer. He used to do needle sharpening in the college days. Needle sharing in college days to take IV drugs users. OMG, see IV drugs user. He was positive for the hepatitis C. See, positive for the hepatitis C meaning he may be having the chances of getting HCC, hepatocellular carcinoma. Okay, now for the hepatitis B and C. So for this guys, what is the main victim is that there is a depletion of the CD95 receptors. Okay, this is you have to match the answer. Okay, na hepatitis C, CD95 is how you have to remember this one. Okay, done. See here, this is very important. See, I think you guys know this answer. Yeah, a 20-year-old man visited a red light area and had unprotected sexual exposure. He developed a lesion on his penis and visited a steady clinic. You prescribed benzathine penicillin injection. Oh my goodness. Okay, now after 10 days he back to clinic and he said that the development of urticaria and mobile rash. What is the type of hypersensitivity reaction? First of all, see the options. It will not the type 1. Okay, it is the IgE exposure, isn't it? IgE. Okay, now type 3, it is the IgG, isn't it? Type 3. Yeah, type 2 IgM type. And this is the antigen antibody mediated. See here, this is the delayed type. Okay, as you and everything know about this one. So we are giving what? We are giving serum. Isn't it? This is a penicillin serum only na. So we are giving injection serum. We are giving serum to the patient. So after that he developed this everything whole body. So this is going towards the immune complex antigen antibody. This is what type 3. When a type 2, it is the antigen antibody. Whenever you see the any injectables they are giving, this is you are going towards the type 3. Okay, na? Done. Next one. I don't know why. Okay, done. Next one. 8th question. Done. 8th question here. See, 50-year-old obese smoker who is lawyer by profession started having chest pain on her. He was rushed to the hospital where he saw ST depression which T1 was. His cardiac markers were elevated. Which are the following is? See here. Actually he was already diagnosed. He was already diagnosed with the. This is the case of he was already diagnosed with the STEMI. He was already diagnosed with the STEMI. Already he has the previous history. And after that he see it's a late complication. See, meaning he have already STEMI, but after this he developed one complication which is your Dessler syndrome. I already discussed this about this one many times in our group. Okay, complication is your Dessler syndrome. Okay, now you have to like this, you have to maintain this one. This is no need. This is not clear in the book. Yeah, gray matter chappu. Gray matter. Okay, gray matter is a collection of cell bodies. Okay, see here. Yeah, see here, this is gray only. Gray. This is the beta test. Your in ENT you will do beta test now. Beta test, what cranial now you are testing for your 8th cranial now. This is a NOR, is collection of axons, so it is going to your white matter. Okay, that's it, very easy. 10th, okay, 10th, okay, done. Next 11th one, see here what happened, please read the question once. Read the question, try to solve. Pulse rate, okay, 120 bp, 70. Oh OMG, this is going towards your trolley, isn't it? And he was blood group is B positive, and he was given 6 units of packed RBC. It is a transfusion, okay, this is a transfusion reaction. It's going towards your antigen antibody mediated. It is your antigen antibody mediated. So antigen antibody mediated, as I said, it is a, what is your type 2? This is a IgM type, okay. IgG, as I said, you have to give the serum from the outside. It will present whole bodies, okay. IgA no, IgE no, okay, GIM. Every time you have to cross check the options, that's it. 11, 12. This is what happened here. I think whenever you are rotating in the general medicine department, I think you guys know what is the test. It is test for the dicokinesia, okay na, for the cerebellar, for the cerebellar lesion, okay na. It is the finger to nose test, okay, finger to nose test for the checking the any cerebellum lesions here, okay na. So here the option, the paleocerebellum, neocerebellum, archicerebellum, and superior cerebellum. Option D is rule out here. See, it must be neocerebellum, okay. See, this is the one, neocerebellum. Wait, yeah, this is your neocerebellum, okay. Next one, this is very easy. See here, a 50-year-old post-menopause woman started having the abdominal distension with the development of cachexia, okay na, hypoxia. On examination, bloated fluid thrill present with a reduced intensity of bowel sound. MRI abdomen showed presence of 10 into 12 centimeter tumor originating in her left ovary and free fluid in the abdomen. See, free fluid in the abdomen, what amma? It means it's going towards your ascites, okay, ascites. Whenever you are going to do the ascitic tap here, you will get the, obviously, MRI shows there is a tumor. Whenever you are going to the ascitic tap, you will also get the tumor only now, and tumor only. So they are asking which of the following is the method of spread of this tumor. It's going to your translumic spread, okay now, your translumic spread, okay. As I said here, this is a fluid thrill goes, okay. The main spread of ovarian tumor is translumic spread, which means via exfoliation of the cells, okay, exfoliation of the cells here. Just remember this one. Yeah, see this one. A 60-year-old smoker developed multiple episode of blood in sputum in last 2 months, associated with significant weight loss. HRCT chest shows 3 into 3 centimeter endobronchial mass. Here, see, whenever you are going to see this one, please try to see this. It shows what amma? LMYC proto-oncogene. What is that? LMYC proto-oncogene, meaning, see here, L for what amma? Lung, means lung. L for your lung. It is for the small cell carcinoma of the lung. See, this is the proto-oncogene LMYC. This is very easy. Just remember this one. Okay, this is the LMYC. Okay, na, LMYC. So see, L is L, A for amplification, S for the small cell carcinoma, N for what amma? Neuroblastoma, and both for the, and also small cell carcinoma of lung. It is also the mechanism is the amplification. C-mycin, CCC translocation, like the same pronunciation, C-mycin translocation is for the Burkitt's lymphoma. That's it. It's very easy. So this is how you have to remember. The next one, 65-year-old man old man has multiple episodes of painless hematuria over the past 4 months. Now he developed urinary retention and urosepsis. So in this round, you have to ask the history of the patient. You have to ask the history of patient because there is it will be because of the you have to aniline. Okay, na aniline dye exposure is causing the bladder cancer and also the occupation. That's why you have to, because he is always a what 65-year-old man and multiple episodes of painless hematuria. So you have to ask the history, and also you know the arsenic also it causes the urinary bladder cancer. Okay. Done. Next one. Done. Yeah. See here now. 65-year-old type 2 diabetes mellitus patient had undergone kidney transfusion at your tertiary care hospital in month of January 2020. Now he has a graft failure in the month of 2020 October, leading to what is the cause of? See here, just tell me here, what is the duration here? It's more than 6 months already, no? It's more than 6 months already, meaning January 2020 month and month here 20, and again he come back to October. So how many months are here? It's almost more than 6 months here. Okay na? So almost 6 months here, so it's going towards your polyoma BK virus. Okay, polyoma BK virus. Done. Polyoma BK virus. See here, this is your most common opportunity infection is the urinary transmission is the more than 6 months is going to your BK virus, herpes zoster, hepatitis B, C. Within 1 month you have to see the wound infections, oral candidiasis, urinary tract infection. Early 1 to 6 months pneumocystosis carni, cytomegalovirus, legionella and listeria. Done. Next 17th. Yeah. See here, a 35-year-old female came to gynae OPD with complaints of developing post-coital bleeding and poor genital hygiene. For specialized examination, there is a lesion of, oh my goodness, this is going to your HP virus. This is due to HP virus. As you know that HP virus, viral proteins. As I know only one thing here, E6 and E7. Okay, I know only viral protein E6 or E7, and also let me know, is it this tumor is tumor due to over expression or under expression? It must be over expression only. Over expression of viral protein E6, E7 and loss of P53 and PRP. Loss, everything will loss. So there is over expression is going to your HP virus. So okay, done. 17th. Yeah. See here, 19th one here. A 50-year-old obese smoker had developed atherosclerosis. So atherosclerosis, whenever you see the atherosclerosis, it's going towards what? Athero means what? This is the cholesterol. Your cholesterol embolism. Okay. See here, this is very easy. See here, this is very easy. See this one. This is the ascitic. This is the ascitic case. Okay, the doctor is doing the percussion. After doing percussion, and he said that, and he kept the hand here to check for the if there is any fluid coming or not here. So if there is any fluid, if there is a ascites, so he will he kept that hand here, and he will observe the flow of the water. Then if there is a ascites here. Okay na? So this is called your shifting dullness. Your shifting dullness. Okay na? It is your shifting dullness. रुका एक मिनट. So this is your shifting dullness. So shifting dullness, as I said here, shifting dullness. Okay, done. Thank you very much.